Welcome to Sidelined, your dose of analysis on the biggest injuries and conditions affecting sports today. Featuring insights from the doctors of Palm Beach Health Network Physician Group in partnership with ESPN West Palm. Now, here's your host, David DePino.
Welcome to the Sideline Podcast. We're here with Dr. Daniel Vela-Duarte, a neurointerventionalist with Palm Beach Neuroscience Institute, PBNI, neurology practice in West Palm Beach, and on staff at St. Mary's Medical Center. Dr. Vela-Duarte joins us here on the Sideline Podcast to talk about stroke care. Dr. Vela-Duarte, thank you for joining the Sideline Podcast. How you doing?
Doing very well, David. Thank you for the invitation. It's a pleasure to be here.
Thank you for joining us. A brain attack or stroke can happen to anyone at any age, and recently stories of athletes across pro and college sports have brought stroke awareness to the forefront. The sports world was stunned a few years ago when Team USA track and field and four-time gold medal winner, world record holder in the 200 meters sprinter Michael Johnson reportedly suffered a stroke. Last year, Jonah Robertson, a 23-year-old Florida Atlantic University FAU Owls lacrosse player, reportedly suffered a stroke, and in the NFL, Carolina Panthers defensive end Henry Anderson revealed he had a stroke just last season. Dr. Vela-Duarte, media reports point to Michael Johnson's stroke occurring in the right side of his brain, in turn affecting his mobility and coordination on his complete left side. Johnson was reported to have a thalamus or leukonar stroke. I may have not said that right, but can you explain that type of stroke?
So, yes, absolutely. The thalamus is one of the main structures in the brain where a cluster of different neurons get all together to receive the information from the gray matter or from the cortex and send out all the important information to the different parts of the body. So if you've been in New York and you remember how Grand Central Station is, it gets many buses and trains from everywhere, and it sends them out to all the stations. So that is the thalamus, and that's how I kind of remember it and explain it very easily to patients. The thalamus is one of the most important, deepest structures in the brain, and its supply, its vascular supply and all the oxygen and nutrients that it gets. It's supplied by the most millimetric, smallest arteries that you can imagine. And so a lacunar stroke is that type of a stroke where one of these millimetric, very tiny arteries gets clogged up with a blood clot, a very tiny blood clot. And being such an important structure, even if the stroke, the area that is affected by this tiny artery, being one of the most important structures, it can have a tremendous effect or a repercussion in the body. And so a lacunar stroke of the thalamus can have severe symptoms. And these symptoms can be weakness on one side of the body, can be absence of sensation or decreased sensation in a side of the body. It can affect speech. It can affect sensation of the face. It's one of my teachers, my attendings when I was in training, he called it a very expensive real estate in the brain.
Great explanation. Why does a stroke affect the opposite side of the body that it occurs on?
So the way the anatomy of the brain is organized, if you remember our basic biology classes, so that the tissue of the brain is made of neurons, and then the neuron has a little body, and then the axon. The axon is like a wire. Just imagine a copper wire. These wires conduct information or electrical stimuli to your muscle, to your organs, to your eyes, and so these wires get out of the thalamus, and so in our brain we are cross-wired for everything. So the right side of the thalamus would control the left side of the body, and the opposite. What you have in the right side of the cortex, or your right hemisphere, and all those neurons that are on the right side of your hemisphere would control the sensation and the movement of the left side of your body. And then the same thing is true for the thalamus. That's the best way to understand it. We're cross-wired. That's it.
Johnson was taken to a hospital just 20 minutes after his wife noticed the symptoms of stroke, and which was very important in terms of care. Can you explain why time is brain in stroke care?
Time is brain because when there is a blood clot affecting one of these large or tiny arteries, the faster the patient gets to the emergency department to receive the appropriate care and medicines to attempt getting rid of the clot that is causing the symptoms or blocking that artery, the faster the patient will recover, and the less the impact of the damage, the less damage will occur in the brain. So, if the patient is taken to a comprehensive stroke center where the what we call the thrombolytic medication, or it's an IV medication that is infused to break down or soften the clot can disappear, and the circulation of that part of the brain can be reestablished. If it is a larger blood clot blocking off one of the main arteries, there are procedures where we can remove the clot and reestablish that circulation. So time is brain because if you let that blood clot sit there for a long time, precious tissue, precious neurons are going to be lost, deprived of oxygen and nutrients, and that patient is going to lose vital function or vital functionality, walking, speaking, comprehending the mobility of one side of the body where contralateral, or the opposite where the lesion happened. So the faster the patient gets there, the higher the chance of recovering.
Reportedly, doctors thought Johnson may never walk again, but amazingly, he made 100% recovery from that stroke thanks to rehabilitation and self-determination. Locally, FAU lacrosse player Jonah Robertson's story was in the news late last year. According to WPBF Channel 25 News, Robertson's girlfriend, an emergency room nurse, recognized the signs of a stroke, and he arrived at the hospital by ambulance, where the blood clot that had traveled to his brain was dissolved with medicine, and he has been symptom-free. And he was symptom-free, after the treatment. Dr. Vela-Duarte, why is it important to call 911 and the significance of getting to a comprehensive stroke center like St. Mary's Medical Center so important in emergent stroke care?
So he was very lucky that his significant other was a nurse trained on recognizing the symptoms, which is what we, even not medical care people or the general population, should learn. And so then the second thing is that he received the medication I mentioned, the thrombolytic or the clot buster medication to dissolve the clot. So why is it important to call 911 and take the patient to the appropriate center? Because not all hospitals will have this medication to be given to the appropriate patient, to the patient that needs an IV infusion of this clot buster medication, because not every single hospital would have the trained team of neurointerventionalists, neurosurgeons, neurologists, ICU doctors, critical care nurses, critical care doctors to take care of this condition in the acute phase, in the moment that it happens. And so you don't want to lose time taking the patient to another hospital that for sure that it will take care of part of the situation, but they cannot offer these medications or the endovascular surgical treatment to remove the clot, and time is wasted there because the patient has to be transferred to another facility, to a bigger comprehensive hospital where these therapies are available, and this can involve 1 hour, 2 hours, or even more, depending of where the patient is. And that's why it's important. 911, our paramedics, our community has put tremendous effort into training our medics and firefighters to recognize the symptoms, the severity, to understand where the patient has to be taken, to understand what kind of hospitals offer this therapy, to just drive there, communicate with us in advance, so that we get everything going, the team in place, the catheters ready, everything ready to go to receive the patient, bring the patient to the OR, and do the procedure as fast as possible.
You mentioned the clot busting drug. You mentioned endovascular treatment. What are some of those treatment options that are available to you at a comprehensive stroke center like St. Mary's Medical Center?
So at St. Mary's, we are blessed and fortunate to be a comprehensive stroke center. We have everything available. We have all the devices. We are a team of neurointerventionalists that are available 24/7 all around the year. We have neuro ICU and ICU care available, a dedicated team of vascular neurologists and trained nurses, ICU nurses with enough expertise in neurosurgical illnesses and a stroke, and that's what makes the St. Mary's and St. Mary's Medical Center and a comprehensive center.
You mentioned stroke signs and symptoms. The next Carolina Panthers defensive end, Henry Anderson, revealed he was at home when his extremities went numb, his speech was slurred, and when he contacted medical staff and he was diagnosed with a minor stroke. Anderson was only out from playing, pro football for 6 weeks. What are the signs and symptoms of a stroke? And if you could share that the Be Fast acronym, from the American Heart Association, American Stroke Association, that can help, the general people in the general population, like you mentioned before, recognize stroke symptoms.
Yeah, David. Emergency physicians, neurologists, neurosurgeons, neurointerventionalists, cardiologists, we have emphasized we are allies of the American Heart Association. And so we spread the word of the acronym that they created, the American Heart Association created, to increase or raise awareness on how to recognize, how to spot a stroke. Every time you recognize, if you have learned the signs and symptoms, every time you see someone most likely having symptoms, you want to be fast. That's the acronym, Be Fast. And Be Fast stands for be balance. So any abnormality of the gait of the walking, the way the patient or the individual is standing, if it's veering to one of the sides, if the patient is not walking correctly, something is off with their walk, that's one sign of alarm. E for eyes, sudden onset of vision loss. All of a sudden that someone loses their vision out of the right or left eye, that raises concerns about a stroke of the eye, which can be a blood clot going into one of the arteries that supplies the eye, or even can affect the back part of the brain where all our visual information is processed. Face, if the expression of the mouth, if the smile looks uneven, kind of a deviated corner of the mouth, one of the sides doesn't look even when they smile, when they talk. If you ask that individual to stick their tongue out, it's going to look asymmetric. It's not going to look the same you compare both sides, left and right, and it's not going to look the same. So that also raises concerns. Arm or leg, in this case is Be Fast. So FA, A stands for arm. The strength of the arm may be affected in the compromised side. So you ask the patient to lift the right or the left arm, and if one of the upper extremities is basically drifting down, but if it is too heavy for the patient to lift it, then you're concerned that the strength is somehow off. This individual may not have enough strength to just do what has been instructed. Speech, they may be very slurred. The speech may be very slurred, hard to understand, or they are actually speaking a lot of words that make not sense. That make not sense at all. Disconnect or words that are not connected very well among themselves. sentences that make no sense, or just the lack of comprehension. They can be completely mute. You instruct them to do something, to open their eyes, to tell you their name, and they're not responding. They're just not processing, understanding a command. So that the speech can be absent, but comprehension is also important. In this case, be fast. The S stands for speech. Any slur speech or gibberish, that raises the flag. And lastly, T stands for time. So again, these symptoms are always concerning for a stroke. You don't want to sleep through the symptoms. You don't want to wait for them to get worse, and you want to minimize the possible damage from the stroke, which all means you have to call 911 immediately with no hesitation. Why? Some people consider that if the symptoms are minor or very mild, if the speech is somehow off, if the sensation of the skin in one of the side of the body, or if the vision is a little blurred but not, it's kind of off, those symptoms, they think the symptoms are going to go away. They are not going to. In some occasion, in some situations, these symptoms are transient, and that's what we call transient ischemic attack. The symptoms may just last 20, 30 minutes, but that's one of the most alarming signs that a real massive stroke can happen. So bottom line is, you don't want to wait. Don't hesitate about calling 911, because a stroke can be devastating, can be fatal, affect the all the capacity of a human being: speech, comprehension, walking. So yeah, that's it. Be fast, spot the stroke, learn, do your job, do this, embrace this mission, learn the acronym, be fast, learn to understand the symptoms. In other words, balance, gait difficulties, lack of vision, facial abnormalities, crooked corner of the mouth, gibberish, slur speech, weakness of the arm or leg, and just call 911.
You've explained stroke, TIA, signs and symptoms of stroke, treatments already. What are some risk factors that people can, look out for, or, make changes in their life to prevent a stroke in the first place? I know sometimes strokes just happen. It's genetics or whatever else. But what are some of the risk factors that people can, eliminate?
So as you can imagine, the blood clots form and block an artery. The artery can be narrow. And why does it get narrow? Because our biology and normal aging is that cholesterol will deposit, will be stored in the walls of the artery. And that's why. How do we prevent that? Exercising, diet, preventing the onset of elevated or raised blood pressure. So we aim to prevent storage of that bad cholesterol inside the artery, clogging up those tiny arteries, clogging up those vessels that may not just take the necessary blood flow to a certain part of the brain. And so watching your cholesterol, if you are diabetic, the excess of circulating sugar would promote further accumulation and storing of bad cholesterol. So cholesterol, glucose or diabetes, blood pressure, it all comes from a diet. And diet is important because it keeps, it's aimed to keep the arteries clean. Exercise as well. Smoking is one of the risk factors that, of course, we're more than welcome to eliminate of our life. If someone smokes, there's no need to inhale those toxins and all those poisons from the cigarettes. Why? Because all those substances are going to accumulate, whether you want it or not. They're going to accumulate in the tissues of the arteries, and they would promote inflammation inside the artery, clotting, narrowing, stiffness of the arteries. And if the arteries get stiff, your blood pressure is going to be worse, and that all ends up in increased vascular risk factors that could affect your heart, could affect your kidneys, your brain. So you can have a brain attack, heart attack, or a renal failure at some point. or decreased vision. So it's all about vascular health, and those are the main risk factors that can be tackled down and addressed.
Besides stroke care, what other types of neurological care do you provide?
So in general, a neurointerventionist, we are trained to do minimally invasive surgeries inside the arteries, and that's why it's called endovascular, so inside the vessels surgery, so endovascular surgery. We take care of the emerging conditions such as a stroke or ischemic stroke, where the blood clot gets stuck in an artery and stops the blood flow from supplying the normal tissue. We repair arteries when they burst. Why do they burst? Because of elevated blood pressure. So sometimes we have to fix these ruptured arteries that triggered a brain bleed. And sometimes we find aneurysms. What is an aneurysm? It's a pouch, it's a little pouch or a blister that grows off the sidewall of the artery, and in a debilitated artery, and it continues growing, and as the blood passes through that vessel, blood gets into the pouch, and the constant movement of the blood flow can actually rupture that pouch, and that's what causes a brain bleed. So we take care of rupture aneurysms. We take care of vascular malformations, which are conditions where vessels are basically malformed and intermix between veins and arteries, forming tangles of vessels inside the brain tissue. Sometimes they tend to bleed. They cause inflammation. They cause seizures. We treat fistulas. What is a fistula? A fistula is an abnormal connection of a direct connection of an artery and a vein where it should not exist. And all those conditions are not only treated in the brain, but also in the spine, in the spinal cord. We also take care of those. Those are less frequent, harder to treat, harder to diagnose, but it's the same. It's the central nervous system. They can also appear along the trajectory of the spinal cord. We treat intracranial hypertension from strictures or narrowing of the draining veins inside the head, and that can cause not only increased intracranial pressure and severe headaches, sometimes seizures, decreased vision, but also tinnitus, which is this annoying, unbearable buzzing, or like an unbearable sound inside your head. And we treat other conditions where there are bleeds from the meninges as well, and accumulations or collections of blood, and we call them subdural hematomas. Sometimes we work in collaboration with neurosurgery to decrease the blood flow to tumors so that they can remove the tumor safely and faster with a safer surgical time and procedure. So we decrease the blood flow to the vascular bed of the tumor, and then they debulk or remove the tumor. So those are like the main conditions that we treat at this point.
Well, thank you for this in-depth interview on neuroendovascular surgery and interventional neurology. I know it's called so many different things.
Yes, it has.
But you're truly an expert and experienced in the field, and I hope you'll join us again on the Sideline podcast in the future.
My pleasure. I hope to be with you again, touching on another topic, and thank you for the invitation.
Like Dr. Vela-Duarte said, he specializes in the detection and endovascular treatment of aneurysms, acute ischemic stroke, mechanical thrombectomy, detection and treatment of arteriovenous malformations, and dural arteriovenous fistula, tinnitus, increased intracranial hypertension, spinal angiography. Dr. Vela-Duarte is board certified in general neurology and vascular neurology with the American Board of Psychiatry and Neurology. For more information on Dr. Daniel Vela-Duarte, visit pbni.com. The Palm Beach Neuroscience Institute is located at Village Commons, 901 Village Boulevard, Suite 702, West Palm Beach. request an appointment with Dr. Vela-Duarte, visit pbni.com or call his office at 561-882-6214. And once again, thank you for listening to this episode of the Sideline Podcast. Please tune in next time to hear doctors from the Palm Beach Health Network Physician Group explain the ailments trending across the sports world and the medical care our physicians provide right here across Palm Beach County and the Treasure Coast.